Big news in the fight over health care reform tonight. The Republican Party is staking out new ground, redrawing the battle lines, dramatically switching strategies. RNC Chair Michael Steele, who is naturally on the front lines of these new tactical developments, chose today to take on the toughest enemy of all, a man who can't be out-argued, a man willing to do or say anything to win, and his name, Michael Steele. Yeah, you're about to see is a brutal Steele versus Steele political smackdown. In one corner, the Michael Steele of Monday, the one casting himself and his party as the noble defenders of Medicare. And in the other, the Michael Steele of today, the one taking on the, quote, already bankrupt program we can't afford.
Our seniors have really come under fire in the last few weeks as more and more proposals look to be cutting benefits out of Medicare program. This single-payer program known as Medicare is a very good example of what we should not have happen with all of our health care. We want to make sure that we are not cutting the Medicare program. Government cannot run a health care system. They've already shown that.
Why fight the Democrats when you can adopt the Democrats' position for a day and then fight yourself? I'm all for people evolving their positions over time. But over time, I'm thinking, more than 24 hours. But Michael Steele isn't the only Republican who suddenly seems to be representing both sides of the debate over health care reform. What you're going to see next is really heartbreaking. And I mean this. It's an exchange between a constituent at a town hall meeting and a Republican Senator, Tom Coburn of Oklahoma.
Senator Coburn, we need help. My husband has traumatic brain injury. His health insurance will not cover him to eat and drink. And what I need to know is, are you going to help him where he can eat and drink? We left the nursing home and they told us we're on our own. He left with the feeding tube. I've been working with him, but I'm not a speech pathologist, a professional that takes 6 years for a master's, and I'm trying to get him to eat and drink again, and this means so much to me.
Well, I think, first of all, yeah, we'll help. The first thing we'll do is see what we can do individually to help you through our office. But the other thing that's missing in this debate is us as neighbors helping people that need our help. We tend to... The idea that the government is the solution to our problems is a very inaccurate statement.
Now, Senator Coburn's office says they have followed up with that woman, that members of his staff are working with her, and we, of course, sincerely hope they can help her and her family. But while it's commendable that Senator Coburn is helping this woman as she struggles to get vitally important health care for her husband, he seems to be forgetting that, as a U.S. Senator, he is the government, and he's using his office as an official of the government to help this poor woman and her family. Of course, it's great that he's helping her, but it's just plain old confusing to hear within one answer that his office will help, but that he decries government involvement in health care. He might want to be careful because, here's the thing, if Senator Coburn's answer to everyone who's or underinsured is, give me a call, he may have about 71 million voicemails very soon. Joining us now is Connie Schultz, Pulitzer Prize-winning columnist who has been writing about the health care debate for the Plain Dealer in Cleveland, Ohio. Connie, nice to see you.
Thank you, Allison. It's good to be here.
Now, after offering to help this woman and her husband, Senator Coburn argued that people should be helping each other instead of getting the government involved. In your opinion, does this position have a place in the current big-picture health reform debate?
I have to say that, first and foremost, when I watched that video, and I've watched it a couple times, think of what it took for that woman to go to that meeting and to bleed that way publicly, and his response is so dispassionate. I don't understand why the first thing he said wasn't, I am so sorry this is happening to you in America. I'm so sorry that you are suffering and that your husband is suffering. Instead, he's got a very immediate response, which all senators can have. Yes, his office will make a difference for her. That's the whole point. When the government gets involved, it can solve these problems, and he knows that. And he, at least, you want to give him credit for doing that. I guess that's true. What I don't understand is how he isn't willing to acknowledge that. And what is this neighbors helping neighbors? What are they supposed to do? Throw bake sales? to raise money for this man's health care? What does that mean, neighbors helping neighbors? I would say that the majority of Americans who are asking for universal health care, or certainly asking for affordable health care for all Americans, that's helping your neighbor. That's advocating for your neighbor. And we do know that despite some of these outbursts at town hall meetings, we know that the majority of Americans do want health care reform.
But one of the frustrating things about trying to learn more about the health care debate is this manipulation of facts on all sides. The RNC chair is continuing to tell people that there's this manual out there encouraging veterans to check out early. Why have the anti-reform people moved on to veterans?
Well, I think they were running out of steam on America's #1 most vulnerable group, senior citizens, and so now they're trying to prey upon veterans because, as we know, during the previous administration, there were a lot of problems with veterans' health care and the way veterans were treated, period. So they're feeling vulnerable. And they, the other thing is, don't forget always that we're hardwired to fear. We will believe something that we're supposed to be afraid of first. We retreat, and then we'll look back later to see whether we had a real reason to be afraid. And they're preying on fear, and this has become a game for too many of the Republicans. And I wish I would make an appeal to the elected Democrats in the Senate and the House. You campaigned across the country to elect Barack Obama. You campaigned across the country telling Americans, you can trust this man. You can trust what he's proposing for America. This is no surprise now that he's proposing health care reform. It was a major plank of his campaign. If you thought we could believe in him then, I wish each and every one of you that would be the universal message now. We can trust him. We can trust this plan. We can trust that we can change the way health care is delivered in this country.
You're a very interesting person to talk to because, of course, you're a columnist in a politically important state, Ohio. You're also married to the Democratic Senator Sherrod Brown.
Right.
Can you give us a sense of how this debate is playing out in your front yard?
Well, in Ohio, I get, on average, this is not an exaggeration, and I've been counting because I've been trying to keep track, I get at least 50 emails a day that are those chain emails that have, it looks very official, and it has section by section on all the health care proposals, and they are all flat-out lies. PolitiFact.com has done a wonderful job of showing just how badly written these, they're not true, is basically what they're showing. And my husband, the senator, got one earlier last week from an attorney who said, here's why I'm afraid of this health care reform. My husband started to read a couple lines from it, and I said, wait a minute. I can tell you exactly what that is. And I got on PolitiFact.com, and I showed him the email.
You mentioned town hall meetings earlier, and there was one held by Republican Senator Chuck Grassley of Iowa yesterday, and a man in attendance reportedly compared President Obama to Hitler and said he'd take a gun to Washington if enough people would go with him. How worried do you think we should be about violent language like this?
Well, I felt this way from the moment that Sarah Palin started campaigning and using hate language, and I wrote extensively about that during the presidential race. This hate language is stirring up the worst among us. The Southern Poverty Law Center has been talking about how the citizen militia is churning again because of the hate talk. This is not without consequences. My husband and I both have been getting some threats. You expect that. I mean, we're in the public and we're advocating for something as a columnist and as a senator. But I do worry that innocent people are feeling scared. And when people get scared, they run. They run away from it. They don't want to embrace change. And in that way, I think the Republicans are hoping they can win, because it's the only way people who oppose health care reform right now are going to win, and that's by making everybody just scared to death. I don't think it's going to work. I don't think the majority of Americans are buying it. But I hate seeing people preyed upon like this. And if you could take some of the calls I've been getting from senior citizens across the state, it would break your heart.
Connie Schultz, Pulitzer Prize-winning columnist for The Plain Dealer in Cleveland. Thank you so much for taking the time tonight.
Thanks for addressing the issue yet again, Alison. I appreciate it.